So I'm very excited to be here, and thank you very much for having me. Actually, my name is Yannick Eller, and I'm a junior attending from Switzerland, as you just heard. It's a little special in Switzerland because, of course, my impressions are totally dyed in European experience, but I'm still from the US, and I try to get this over somehow because I'm still feeling at home when I come back here. And this is, like I said, I renamed this because I'm really passionate about the issue, and I also put onc into it, oncology, meaning because of my European impressions. The Europeans have kind of like the residency, for instance, like in the UK and in Scandinavia, to include the medical oncologist and also the therapeutic arm of nuclear medicine. So I'm thinking radiation oncology, so to say, is also the invisible pillar of all of oncology, which is why I'm also referring to oncology in general, so general oncology or oncology in general, when students ask me what the hell is oncology about. This is when including this. I just want to scratch the surface because this is totally too much to go into detail. That's why I passed the handout of the expose around. And first of all, I'd like to get 5 points through you, which is something to clarify up front. First of all, networking is a matter of personal contact, and otherwise it doesn't work, at least if you don't see each other in a regular fashion. Second is, the best thing to begin with is with the medical students, of course, because this is the future of a profession, and in my opinion, radiation oncology, of course, is the best one, best specialty there is. And third one, undersupply in Europe. We don't have any juniors to do radiation oncology or oncology in general because of several issues I'm going to touch slightly, versus the overall in this country. So there's many people who would like to get over, but don't know how. For instance, like I talked to some colleagues in the back corner who totally would like to facilitate exchanges to Europe, for instance, like to Heidelberg in Germany or Switzerland to the PSI, but it's just not possible because there's no interconnection in between. And I consider myself to be some kind of a US European, and maybe the perfect person to dance around the big shots. 4, we got several anti-assessing groups who also try to cover this issue, but they don't interconnect the clinicians with the students, so the students just don't know what oncology is about. If you ask the students in our countries, they just say, okay, oncology is about the people helping to die, something like that. And 5, there's many opportunities to do and to have even self-education or to self-promote your education in oncology, but nobody knows about it. And then I got 5 other points which touch the purpose of Generation X-ray. There we go. The first one put in Roman digits. It's about the summer schools provided in Europe. These are 4 of them, and I got them from ESMO, the European Society of Medical Oncology. But the students, they don't know about these summer schools, and there would be perfect opportunities just to have yourself some more education, because it's just slightly scratched in syllabi. For instance, like in my medical school, we had 36 modules in general, and just half a module touched oncology. It's just not enough, in my opinion. Second Roman digit. This is about developing countries, a study they conveyed, and it says it's a long way from reaching the standard knowledge and skills required in oncology. So the prevalence in cancer is just exceeding the knowledge in physicians. But this is, of course, you could say it's just about developing countries. But we go to Canada, and they found out. Okay, this is a slide from the ESMO board. Talking about medical oncology and radiation oncology, so we're just in somewhere near not existent. And I think this should be changed. This is a study from the UK, also telling us that we should improve the education in the undergraduate medical school. and the medical trainees clearly need to be exposed to the oncology practice because it's just enough. Third Roman digit. So this is from our mission, this is from our statutes, and it's about the mission of Generation X-Ray. We like to facilitate the international collaboration, and just like I said, virtually and especially in person, but bring together aspiring juniors in a regular and repeating manner. And this would, of course, facilitate the fundament for conclusive science, including to future academic leaders. That's what our mission is about. And fourth one, this is a so-called scientific excursion we did in 2016. We visited the CERN in Switzerland, in the French-speaking part, and the PSI, the Paul Scherrer Institute, which is a proton therapy facility in Switzerland. Actually, it's, I think, the oldest one in Europe, yeah. And we named it French because the head of the PSI and the CERN are RadOnc, that's a Swiss speaking part in Switzerland. Also, we did this together with some pleasure visitations in Basel, that's the northern part, and it's German-speaking part in Switzerland. That was the third day, Saturday, so this was pretty successful, that endeavor, and we'd like to repeat that one. That was our first scientific excursion, but we had some predecessing groups as well. They also have been tremendously effective to get some people into radiation oncology. And that is my last Roman digit about. We also need to talk to the students and to the young residents what oncology in general is about. Of course, I don't need to talk to you about this, but most of them, they have like the best day of being enlightened about oncology, because they just don't know that we can better up the situation of that's a 2-minute warning. The better up the situation of the patient, and they don't know what's possible. It's just, and yeah, to wrap it up in short. We don't have the education that should be delivered to the students, in my opinion, and this has been proven by the studies I just showed you. And we could be very efficient about doing this, because this has also been proven by predecessor groups. And I think radiation oncology should also make the first step in that direction. I told you why. And this is, I would call this a young oncology or a young radiation oncology networking. And right now we're in the stadium of gathering ourselves, and we obviously need the support of the professionals from the societies. That's what I'd like to convey you. So thank you very much for hearing me out. This is my old student's address, because in Switzerland we got the habit of changing locations multiply, and you can't be reached anymore by your work mail. So that's why we're allowed to keep our student accounts. So please do connect with me if you're interested in this endeavor. Thank you very much.